name is Marianne. I'm 67 years old and I used to be a financial advisor in a bank, but I'm retired now. 2 years ago, I was diagnosed with type 2 diabetes. It's been difficult accepting all these constraints like diet and exercise and measuring blood sugar and all the rest. But lately, I've been having the most terrible pain in my feet, and it's making my life an absolute misery. I can hardly bear to stand sometimes. I don't even get any peace from the pain at night, and sometimes I'm so uncomfortable that I can't even bear the touch of the bedclothes. I lose count of the number of times I wake up during the night. By morning, I'm more exhausted than when I went to bed. My doctor's given me some tablets, but really, it doesn't make any difference at all. I know he's doing everything he can to help me, but it's just not working, and I don't know what to do next.
Hello, my name is Thomas Weiss and I'm the doctor who's been treating Marianne for the past few weeks. Now in a moment we'll be talking to her to see how the new therapy is working. But before I do this, I want to take you back in time to her diagnosis. And I want to show you how certain questions and techniques and managing patients' expectations can be very helpful both for successful diagnosis and therapy. Come in. Hello, Marianne.
Hello.
What seems to be the problem?
I'm having terrible pain in both my feet and I don't seem to know what's causing it. I've not injured myself, but it's really starting to get me down. And I can hardly stand for the time it takes to cook a meal.
I see from your notes that you have had diabetes for a couple of years and your blood sugar is not very well controlled.
Yes, I know, and I know I should be watching what I eat much more carefully than I do now. But what's that got to do with the pain?
Let's talk about the pain first. I've got a scale here. 0 means no pain, 10 means unbearable pain. Where are you now?
Well, I would say I'm probably a 7 most days. Oh, but take last night, for instance, it was more like a 9. I couldn't get a wink of sleep.
I see you're having serious problems. I will prescribe you an anti-inflammatory for the pain and some sleeping tablets so you will get some rest.
Thank you.
Now, this is the first key moment. I didn't do too badly, but this approach really won't change the outcome for Marianne. I should have probed a bit more, because asking the right question will not only help the patients to describe the severity of the pain, but also the type of pain they're experiencing. So, let's go back to that key moment. It sounds that you're having serious problems and we need to do something for you. But first, let's find out what kind of pain you're suffering from.
Well, I don't know. I find it really hard to describe.
Think of it for a moment. Any description might be helpful for me, no matter how strange.
Well, when I'm standing for a while, it's though my feet are on fire and they're burning up. And then at night, I have this horrible crawling sensation, as though there's ants all running over my feet.
Now we are getting somewhere. Is it worse when you're wearing tight socks?
Oh, I couldn't do that. It's too painful.
Okay, no, I'm pretty certain what you're suffering from, but just to be sure, I will refer you to a specialist for a second opinion. Once again, this is a very interesting key moment. Of course, Referring is an option if you're not 100% sure. But there are some great diagnostic techniques you could use that you should try and give them a go. I'm pretty sure what the problem is, but I just want to do some simple tests to confirm my diagnosis. Can you please slip off your shoes and sit on the couch here? Okay, Marianne, we'll do a few tests for your sensitivity to light touch. Can you close your eyes? And can you tell me if you have any sensation?
No, I can't feel anything. Oh, there's a prickly sensation. Oh, that's quite normal.
Okay. You repeat that for the other side.
No, I can't feel anything. That prickly sensation again. And that's normal.
Good. Now we're doing a test with the tuning fork. Can you feel the vibration?
Yes, I can. Good. Yes.
We do this here down to the ankles. You feel the vibration again?
Yes, I can.
Can you tell me when it stops?
It stopped now. I can't feel anything now.
Good. Same on the side?
Yes, I can feel that, yes. It's stopped now.
Good. Okay, let's do one last test. And can you stand up again? Okay, Marianne. Can you stand up, put your feet together, close your eyes, and try to stay straight. Well, that's a bit difficult. Okay. Now, these tests really helped. Can you come back to the desk and put your shoes on? Marianne, your pain is definitely linked to the diabetes. Over the years, the nerves of the feet have been damaged, and now they're causing something we call neuropathic pain. It is very important to control the diabetes to prevent the pain from getting worse.
Well, I really try to be more disciplined from now on, especially if it's making my pain worse.
Okay. In the meantime, I will prescribe you some tablets that will help to block the pain from the damaged nerves. I think these tablets will do the trick. Just take them for a couple of weeks and then come to see me again. Again, this is a key moment. I made a successful diagnosis and probably prescribed the right medications, but I did not manage Marianne's therapy expectations. If patients know exactly what to expect, they will respond much better. So, let's look how I could have done things differently. I can help you in the meantime by prescribing you some tablets. Now, these tablets will not block the pain completely, but they will make the pain more bearable. They may not seem to work in the first few days, and at first they may cause some side effects. But as the side effects go away, you should feel some pain relief and, of course, an improvement in your quality of life.
Well, that'd certainly be a big plus for me right now.
Okay, take them for a couple of weeks and then come to see me again. Okay, let's see how Marianne's doing a month later. Marianne, come in. Oh, it's nice to see you looking so much better.
Oh, thank you. I've really been watching what I eat, and honestly, I'm feeling so much better for it.
So, how's the pain?
Much better at last. The tablets didn't seem to be doing much at first, but to be honest, I didn't tolerate them very well. But I was expecting that. And then, after a few days, things seemed to improve, and the pain in my feet gradually got better, and I'm even sleeping well.
Great. So, on that scale from 0 to 10, where are you now?
Well, what was it I said before? Was it between 7 and 9? Well, you could perhaps halve that now and say 4 out of 10. And sometimes I don't even notice it at all.
I'm glad to hear that. Now, it's important to continue all the good things you did in the past weeks to control that pain. Let's meet in a few weeks and see how things are doing.
All right.